Hey everyone, welcome back to my channel Medicos Guide. It's Dr. Ida Khan, and today we are diving into an important topic in the field of pathology, that is hypoxia versus hypoxemia. Let's first talk about the normal pathway. Oxygen enters the bloodstream through the lungs. When you inhale, oxygen from the air moves into the smaller sacs, which are called the alveoli in your lungs. Tiny blood vessels called capillaries are located near the alveoli and absorb the oxygen, which is then carried through the blood to the tissues. These terms are often used interchangeably, but they actually refer to different conditions. By the end of this video, you will understand the key differences and why they are both critical to know in medicine. Let's start with hypoxia. In simple terms, hypoxia refers to a lack of oxygen in the tissues. This means that the cells in your body aren't getting enough oxygen to function properly. Oxygen is crucial because it's used by our cells to produce energy. Without enough energy, the tissues can't function efficiently, and that can lead to damage or even death of the cells. This is why hypoxia is such a serious condition. Hypoxia can be caused by several different factors, such as reduced oxygen supply to the lungs, for example, high altitude where there's less oxygen in the air, respiratory diseases like COPD, chronic obstructive pulmonary disease, where the lungs can't properly exchange oxygen. Heart problems: if the heart isn't pumping blood effectively, oxygenated blood isn't reaching the tissues. Anemia: low hemoglobin levels mean less oxygen can be carried to the tissues. In these cases, even if there's enough oxygen in the blood, the tissues may not be able to use it properly. On the other hand, hypoxemia refers to low levels of oxygen in the blood, specifically in the arteries. Arterial blood is the blood that has been oxygenated in the lungs and is pumped by the heart to the rest of the body. So, hypoxemia happens when there is not enough oxygen in this blood supply. Hypoxemia can occur if you are unable to breathe in sufficient oxygen or if the oxygen you inhale doesn't reach your blood. Both proper airflow and blood flow are crucial for maintaining adequate oxygen levels. This is why conditions like lung and heart diseases increase the risk of hypoxemia. Now let's talk about causes of hypoxemia. While hypoxemia has multiple causes, the most common is an underlying condition that affects either breathing or blood circulation, such as heart or lung disorders. Certain medications that slow down breathing can also contribute to hypoxemia. Heart and lung function impairments can result in five main categories of hypoxemia causes: ventilation perfusion mismatch, that is V by Q mismatch, diffusion limitations, hypoventilation, low environmental oxygen, and right to left shunting. To simply put, hypoxemia can occur due to breathing problems, lung diseases, inadequate oxygen in the air, and hypoventilation. Problems, for example, during an asthma attack, where airways narrow and restrict oxygen intake. Lung diseases like pneumonia or pulmonary embolism, which block the exchange of oxygen in the lungs. Inadequate oxygen in the air, like in the high altitude environments. Hypoventilation, that is breathing too slowly or shallowly, which doesn't bring enough oxygen into the lungs. Now, here's where things get interesting. Hypoxemia often leads to hypoxia, but not always. When there's low oxygen in the blood, that is hypoxemia, that means less oxygen is being delivered to the tissues. And over time, this can lead to hypoxia. However, sometimes tissues can become hypoxic even if the oxygen level in the blood is normal, like in the cases of poor circulation. Now let's quickly go over the symptoms of both. Hypoxemia symptoms are often related to the lungs, like shortness of breath, rapid breathing, increased heart rate, and cyanosis, that is blue tint to the lips or skin. Hypoxia symptoms can be more widespread and may include fatigue or weakness, confusion or difficulty concentrating, dizziness, and loss of consciousness in severe cases. Now, how they are diagnosed. A few methods are used to diagnose these conditions. For hypoxemia, a pulse oximeter is commonly used. This device clips onto your finger and measures the oxygen saturation in your blood. Normal levels are usually between 95 to 100%. Anything lower than 90% can indicate hypoxemia. Moreover, arterial blood gas, that is ABG test, and the 6-minute walk test, that is 6 emptability, can be used for the hypoxemia. For hypoxia, the following may be looked at: blood gas tests, imaging studies, or assess the symptoms like confusion or fatigue to determine if the tissues are being affected. The treatment of both conditions depend on the cause. For hypoxemia, increasing the oxygen supply is key. This could be done by administering oxygen therapy or treating the underlying lung or heart conditions. For hypoxia, treatment focuses on restoring oxygen delivery to the tissues, which might include improving circulation, managing respiratory issues, or even using medications to increase blood oxygen levels. So, to wrap things up, hypoxia is when your tissues don't get enough oxygen, and hypoxemia is when there's not enough oxygen in the blood. While they're closely related, they're not the same things, and it's important to understand the distinction. I hope this video helped clarify the differences between these two terms. If you found this helpful, be sure to like and subscribe for more videos on pathology and medical topics. Feel free to leave any questions in the comments below, and I'll see you in the next video. Bye!